think we'll get started now. I'd like to welcome everyone to our Academic Health Department webinar entitled New River Academic Health Department 10 Years In. We have an exciting speaker with us today, and we're looking forward to engaging all of you in discussion about partnerships, in particular, partnership development. Want to ask Maëla if she would, at this point, to go over some of the housekeeping items for our webinar today.
Absolutely. Thank you so much, Bill. So audio is available via computer and phone. We ask that you please keep yourself muted if you're not speaking. Please feel free to have your video on and put comments in the chat at any time. You are also welcome to use the raise your hand feature, and we will allow you to open up your phone line at that time to ask any questions or provide any comments. We know there's a handful of you that might be jumping off early today for a CDC meeting. Don't worry, this meeting is being recorded and will be made available in the next couple of days for everyone to be able to view via our website. Again, just as a reminder, please feel free to use the chat function. Ron and I will be in there answering any questions. If you have questions about any of the content or about technical problems, we are here to assist.
Excellent. Thank you so much, Maëla. Could have the next slide, please. Thank you. A number of you are new to these webinars, so we'd like to introduce the Council on Linkages between Academia and Public Health Practice. The Council is a consensus-driven collaborative comprised of 24 national practice and academic organizations engaged in efforts to improve the education, training, research, and practice of public health. Members of the Council, you can see on the slide here, represent a variety of professional groups, as well as federal agencies, the accrediting bodies for both health departments and academic public health, and the certifying body for public health professionals. The Public Health Foundation serves as a convener and provides staff support for the Council. The Academic Health Department Learning Community is an initiative of the Council that aims to help support organizations working to develop and sustain academic health department partnerships, providing an opportunity for people to explore the idea of these partnerships and learn from each other. Learning Community has been around now since 2011, is open to anyone who's interested in joining, and currently has more than 1,600 members from health departments, academic institutions, and other organizations across the country. The Learning Community offers a way for people to connect with others who are engaged in this work, as well as tools, resources, training, and technical assistance to organizations working to establish and grow academic health department partnerships. Learning community activities include sharing stories and highlighting AHD partnerships, webinars featuring those partnerships, developing resources such as a collection of agreements that organizations have used to formalize partnerships, and all of these resources are freely available to anyone who would like to use them. We would like to provide a brief overview of these partnerships. So to begin with, here's a quick definition. And throughout today's webinar, we'll be talking about partnerships that have been built between health departments and academic institutions, or academic health department partnerships, as we prefer to call them. These partnerships can take a variety of forms, but at their core, they are collaborative, mutually beneficial relationships that serve to strengthen and formalize collaboration. In other words, to move the relationship between the organizations beyond working together sporadically, perhaps just because two individuals happen to know each other, to more of a regular part of how the organizations operate. These partnerships serve to strengthen connections between public health practice and academia, enhance capacity of the organizations involved, and further the pipeline into governmental public health. So with that, let me introduce our speaker today. We're excited to welcome Dr. Sophie Wenzel, the founder and director of the New River Academic Health Department and associate director of the Virginia Tech Center for Public Health Practice and Research. Sophie will share the experiences of New River Academic Health Department, illustrating the process from establishing memoranda of understanding through current initiatives, 10 years now into their partnership. So, Sophie, the floor is yours.
Thank you so much. And thank you to the Public Health Foundation for having me. I presented on this work probably almost 8 years ago, right when we were getting started. So it's exciting to come back and talk about some of the work that we have done. So yes, this is a partnership between Virginia Tech, Department of Population Health Sciences, and the New River Health District, which is one of the local health districts, part of the Virginia Department of Health. Next slide, please. So Bill already talked a little bit about this, but this is my quick take on what is an academic health department. It really is a partnership. You talked about partnerships, partnership between our state or local health department and an academic institution. And I think the thing to remember here is that it's a mutually beneficial partnerships. So both of the organizations are really getting something out of it. And what they get out of it will depend on the partnership, but both partners really get something out of it. Next slide, please. So I thought I would tell you a little bit about how we got started. I'm not sure exactly who is on the call. I'm guessing there's a mix of people that are fully established in an academic health department all the way down to, hey, I think I may be interested. So hopefully this will be helpful for you, just to tell you a little bit about how we got started. So we had an informal relationship between the health department and the Virginia Tech MPH program, where we had students that went in and did, they did their practicum or capstone project maybe. And then we had some staff come in to lecture, but that was it. It was just an informal partnership. And excuse me, we didn't have any sort of formal mentorship. And so right when I started around 2013, I learned about the concept of academic health departments and reached out to the health department to see if this was something that they were interested in. And fortunately at that time too, when I was starting at Virginia Tech, I was also able to start working at the health department at the same time. And that's because my supervisor wrote a joint position. So I had been working part-time at the health department. I got hired at Virginia Tech in a joint position. So at the time, it was 20% of my salary. It's now down to 15 for a variety of reasons. But 20% of my salary was funded by the health department. So I am a Virginia Tech faculty, but 20% of my position is funded by the New River Health District. So I am in a joint position. And I think that's one of the things that really was key in making this partnership so successful. Not to say that you can't have a great academic health department without this, but it really has been helpful. And I'll talk a little bit more about it. The Public Health Foundation was instrumental in helping me get started. At the time, Kathleen Amos, now Mayela Arana, is working with academic health departments. But they just, I spent a lot of time on the phone with Kathleen. She referred me to different academic health departments throughout the country. So 10 years ago, there was not a lot of them, but there's some that just really took the time to talk to me. They shared their sample memorandum of agreements. So I could, pick what worked really well for them and then make it work for us. And of course, Bill Keck's articles, Paul Irwin's articles, different presentations. So if you're just getting started, my tip for you would be, reach out to the academic health department, learning community, mentorship community, look at different memorandums of agreement, talk to the Public Health Foundation. They're here to help you. They want to see you succeed. They want to see you get your academic health department off the ground. Next slide, please. And then relationship building. As we said, this is a partnership. And so relationships are crucial in really getting a partnership on the ground. So find out who's willing to partner, kind of talk to different people, see who's interested. Are there any natural partners? Are there outside the box partners? For us in this case, it was easy because we are one university and one health department. So we're able to work closely together. But sometimes, say you're a state health department, you can work as an academic health department with multiple universities, or one health department, one smaller health department can work with multiple universities. One university can work with several health departments. So all academic health departments can look very different. So you really need to choose who you're going to partner with and what's going to make the most sense. Do you have an existing relationship already, like we had, Virginia Tech and New River Health District? And then who has funding? So for us, it worked out really well that I was able to be hired by Virginia Tech, but have the health department provide the funding because they had some funding. And again, that's been 10 years and it has worked very successfully. So leverage those existing relationships, as you're getting started. Next slide, please. So it was very important for us to make this official. We had this relationship that worked well, but we knew that if we wanted to make this official and really grow, we wanted to have a memorandum of agreement. So we went all the way up to the president for Virginia Tech, to the state health commissioner for the Department of Health. We had some memorandum of agreement for our practicums for our students, but we didn't have anything for an academic health department. So the process started in 2013. We really got the AHD process started in 2014 and then officially signed in 2015. So the 10 years is since we started thinking about becoming an academic health department. And I looked at a lot of different memorandums of agreement that the Public Health Foundation shared with me. It made it really helpful. So these are the categories. We also have our memorandum of agreement that is posted on our website. Please use it. Inform yourself. There's a my joint position, my job description is posted on there. That's all for you to use and to be helpful. And I have a slide at the end that has that. So our memorandum of agreement, we purposefully kept broad because we wanted to be able to grow where we needed to. So we've got our scope of activities, public health professional preparation, which is really our student work, workforce development, practice and research, shared personnel, which is my position. We have an advisory committee. I'll tell you a little bit about that. What shared resources, how we communicate, and any future possibilities. So we kept it broad, and definitely, I'm sure now, 10 years later, there's a lot more academic health departments that have developed. There's MOA out there that you can use to get inspired. Next slide, please. So a little bit more about my joint position. We actually wrote the position as a joint position. So I am full-time and I direct the academic health department, and I'm shared between the two organizations. So like I said, 85% with Virginia Tech, 15% with the health department. And I really do invest my time between both organizations. Pre-COVID, I was on the ground once a week at the health department. Of course, I was remote for a considerable amount of time after that. And then now I'm not necessarily there one day a week, but a few times a month I'm there meeting with different people that I partner with there, community health workers, etc. And the joint position really helps having that central point of contact. So for example, when we're developing practicums for our students, the practicum coordinator will come talk to me, say, okay, what's the capacity there? Who should we send there? Anytime there's any sort of communication between the two organizations, I know what's going on. It helps implement initiatives, and it just helps with that clear and consistent communication because I'm that central liaison between the two organizations. Next slide, please. So we've got these three big buckets that we work on together. Again, mutually beneficial partnership. And our three big buckets are joint practice-based research projects, public health education and training, and then workforce development. Next slide. So we do have an advisory board, and the advisory board is comprised of people from both organizations. So the director, the environmental health manager, and the business administrator from the health district. And then at Virginia Tech, we've got our department head, our program director, the director of the Center for Public Health Practice and Research, who does a lot of this community-based work, and then me as the academic health department director. Next slide. So I'm going to go over some of our major accomplishments over the past 8 years that we've been fully functioning, 10 since we thought about getting started. Next slide. So I'm going to start off talking about our joint practice-based research projects. So being at the health department on a regular basis, I work closely with the health educators, the community health workers, and I'm able to help write different grants. So if the health department is applying for program-based grants, I'm able to help them write the grants. The health department staff there, of course, implements the projects on the ground and manages the programs. And then not always, but on occasion, our Center for Public Health Practice and Research, which I mentioned, which is really the outreach branch of our public health program, is able to help provide external evaluation. And we've seen that it's been really helpful to write a health department program, to write a grant, and then to have this external evaluator that has credibility, that knows the community really well, knows the health department really well, to help provide that external evaluation. So the health department knows that they have a trusted evaluator for their program-based grants. Next, please. Then just an example of the types of practice-based projects that we've had funded. So of course, the Virginia Department of Health has funded a lot of projects, and these are, anywhere from chronic disease prevention to sexual health projects to tobacco prevention. We have some local foundations that have provided us with funding, and then some bigger national organizations such as NACCHO, USDA. And then of course, we recently at the health department got ARPA funding. So that's just to show that as academic health department director, I'm available to be on the ground and to help fill some capacity at the health department, such as, for example, grant writing. And then the center is really able to help as that external evaluator. Next slide, please. And then, so Virginia Tech is academia and does have, the ability to conduct more rigorous research. And so we've been able to partner with the health department in what we believe is, again, mutually beneficial, where the health department provides the programmatic piece, and then the center at Virginia Tech is able to provide the research piece. One example I'll share is that first one there. So this was a project that we did at a regional jail here recently, where the health educator was able to go in and provide educational sessions to women at the jail. And then the center was able to analyze all of the data. And we're hoping to publish that pretty soon. We were able to publish a study on the assessment of contraceptive needs in female inmates. So that was at the same jail, and that was as women were coming into the jail, they had a survey to fill out, and we were assessing what their contraceptive needs was. Again, so the health department on the ground conducting the work, and the Virginia Tech is able to come in and provide that evaluation. So these are just several examples of some more researchy, not so much practice-based research, but research work that we've done together. Next slide, please. And then just the importance of leveraging resources. Just having this joint director position has been really valuable. Having the external evaluator available to New River Health District for grants as needed. And then the importance of having students. I'll talk about students in a bit. Having students engaged on a variety of different projects, both research-based projects and practice-based projects, where the student get the experience on the ground working with the health department, and then the health department has, someone doing work for them. So it's really been a beneficial. Next slide, please. So that's my intro picture, but this is one of our students, Ashley, from a few years ago. She was conducting her practicum with environmental health, and here she is learning how to do a restaurant inspection. So next slide, please. So we have two tracks at Virginia Tech. We are a small public health program. We have a community health promotion and equity track, and we have an infectious disease track. All of our students, as do all Masters of Public Health students in accredited programs, have to do a practicum. We also have them do integrative learning experience, which in our case is team-based and working out with community partners. And so a lot of students choose to work at the health department. This is just one very small list of the types of projects that our community health promotion and equity students have conducted for the health department. So for practicum, they're working individually, and then for integrative learning experience, they're working in teams. So again, we find projects that are needed at the health department and that the students are interested in. Next slide. And then these are projects that our infectious disease track students do. And the great thing at the health department is that there's plenty of opportunities for infectious disease projects, plenty of opportunities for community health projects, and sometimes they merge. Like there was one project, I think it was on the last slide, which was focused on rabies, infectious disease, but also it was doing a survey with humans. So these are different types of projects. Again, all projects that the health department needs. A lot of times they have data, but they don't necessarily have someone to analyze the data. So that's when some of our faculty or some of our students can come in and help analyze the data. So it's kind of a win-win. So again, these are examples of infectious disease projects. Next slide, please. And their students get to present their work. So these are both students that conducted work with the health department, but then were able to go on and present their work. So it gets the health department work known, and then it gets the students the experience to present on some of their work. Next slide, please. I see all the questions coming in, and I'm gonna wait until the end if you don't mind, so I don't get distracted. COVID Crushers. So this is a group of amazing students that just came through fall 2020, spring 2021. Gosh, no, even earlier, spring 2020, like March, April 2020, right when the students, when everything else was closing. We had a group of students that were like, we are public health students, we're not sitting back. And so they worked with our town, they worked with our university and created the COVID Crushers. It's a group of graduate and undergraduate students, and they were just out in the New River Valley, all across our area where we live, working closely with the health department, all public health students, just handing out information, helping. They were the first on the ground at testing events. They were not scared. They just wanted to serve their community and just, help respond. They were, right there at testing events, right there at the vaccine clinics, really served as role models in the community. Everyone knew who the COVID Crushers were. It really was a great example of students just jumping up and helping and getting great experience working for the health department. Our health department director was just eternally grateful for all of the work that the COVID Crushers did on behalf of the health department. Next slide, please. So the Academic Public Health Corps is something that we started just this fall. We were inspired by Massachusetts, who has an Academic Public Health Corps. Theirs is much bigger, and theirs is based out of the state health department. But basically what we were finding is that a lot of our students wanted to work for the health department, but didn't necessarily want to put in a whole 180 hours for their practicum before knowing that they really wanted to work there. So we started this Academic Public Health Corps. The health department has a lot of discrete projects. Anything from, developing a social media toolkit for rabies to putting together a list of all of the big like celebrations, whole bunch of different things, a communications guide, a new logo for a new project that they just don't have time to do. And we have students with a great skill set, a very varied skill set, that want to do little discrete projects to get to know what life at the health department is like without necessarily committing that whole practicum time. So we created the Academic Public Health Corps. The four main departments at the health department that have been really taking advantage of these students is emergency preparedness and response, environmental health, health education, and administration. And I've been evaluating whatever I can, however I can. So the students are all documenting their hours. We just started this fall, but sometime in the spring, I'm going to do some qualitative, just to get information from the health department about how they've used the students, get some information from the students about how it's been beneficial to them, do some process evaluation to see what we can change as we go. But basically we have, it's a form that all the students fill out saying anything from what their skill set is, if they speak a different language, how much time they have per semester, can they go in person? And then on the other side, the health department has a whole list of all the projects that they need, how much time they're going to take when they're due. And then I look at both and I do a matching and I've matched the students. And so far it's been really successful. I think I just saw a question pop up about paying interns. It depends on the project. Most of the time they're not paid right now, unfortunately, which it's something that I'm continuously looking for. Happy to engage in that conversation. But my plan, at least for the academic health department core, is to get them paid. So even if we can't get them paid for their practicums, I would really love to get them paid for the academic public health core, because students are doing great work and it's so rewarding to them too. You know, the health department, just the other day, it's whatever rabies day or week or month was, maybe a month or two ago, posted this whole work that the students had done and gave them a shout out. I took a screenshot, I sent it to the students and they're like, wow, they're using the work that we just created. So it really is a win-win for both. So that project has been very successful and is ongoing. And some of them went on the ground, like they needed pictures for a new website. So students went and took pictures. So really a lot of different opportunities for students to get involved. Next slide, please. So I see this as like a value added or leveraging resources. So we had applied for a PHAP fellow through the CDC at the health department 3 times and just kept on being unsuccessful. And we're like, well, let's take a different approach. Let's apply as an academic health department. So he would have one supervisor at Virginia Tech and the other supervisor at New River Health District. And I don't know if it was that it was an academic health department or because we didn't change much else, and we got a PHAP fellow. So I like to think that it's because we kind of expanded, thought outside the box. And so he mostly worked at the health department, but he knew that he had the Virginia Tech liaison just to kind of expand what he could do. And then we also were able to apply for and get a CSTE fellow a few years ago. She's actually still working at the health department now. But so through the academic health department, we applied for her. Next slide, please. So a little bit more in workforce development. So as hopefully a lot of you know, programs that are accredited through CEF have to do workforce development as part of their duties in public health. So our Center for Public Health Practice and Research conducts most of our workforce development. And of course, they relate back to our program mission and faculty expertise. And we try as much as possible, because this is what we do in public health, is relate to community needs. So what does the community need and how can we kind of make that match and offer what the community needs? Next slide, please. We do regular needs assessments to see what in our region the top public health needs are. So this was 2021. This was, reeling from COVID, a lot of staffing issues, leadership management issues, but also all of these that you see here, including, cultural competency, grant writing, data analysis, and public health 101. I just want you to keep that in the back of your mind, because we're going to get back to that in a few slides. Next slide, please. So just some of our workforce development activities. This is over the years. I picked some of the big ones that we've done. So Let's Talk Public Health was getting high school students onto the Virginia Tech campus to learn about public health and to learn about Virginia Tech. We've done summer conferences for high school teachers. We've done several on nutrition. We have an RD on staff for cooperative extension agents. The Virginia Tech Public Health program is unique is that it's in a vet school. So we function under the One Health model of animals, environment, humans, all being interrelated. And so one of our colleagues conducts career transitions for veterinarians that want to move from being practicing vets to being public health veterinarians. And then also we've held classes for around climate and health and infectious disease. And next slide, please. So something that I'm really excited about that we just started this summer or this fall is this Public Health 101 series. So if you remember, Public Health 101 was one of the things that came up in our workforce development needs assessment. And so we were at a meeting of our advisory board and talking about what are some things that we could do. You know, we definitely had a little bit of a hiatus over the COVID years because obviously we were focused on survival response. And so, you know, we were talking like, well, you know, what's some workforce development that we could do for the health department? And that's when the health department's director said, well, you know, most of my staff don't have public health degrees. They're amazing public health professionals working in the field, but they don't have a public health degree. And I had just taken the CPH exam over that summer. I took it mostly to be able to help our students to kind of see not asking them to do, but it's something that our students have the option of doing. So I took it over the summer, and I loved the review. You know, I had, of course, have public health degrees, but I really enjoyed the review. And so I brought it up and I said, well, what if we see if different, if staff at the New River Health District are interested in sitting for the CPH exam and actually getting a Public Health 101 series following the main domains in the CPH exam. And so I went and talked to the faculty at Virginia Tech. The business administrator went to talk to staff, and staff were super interested. The health department said that they would pay for it for their staff that were eligible to sit for the exam. And I was able to gather 9 or 10 different faculty members here at Virginia Tech. We went through and looked and found someone who had a specialty in each of the domains, even though we're not a big program, we're well evened out. And so we open it up to all New River Health District staff. So even those that can't sit for the exam, for those of you that don't know, to sit for the Certified in Public Health exam, you need a certain years of eligibility, either be a student or have worked in the field a certain amount of years, it depends. So it's open to everyone, even those that can't officially sit for it, they still get all the Public Health 101 review. They're just not gonna be able to sit for the exam. So we've had 4 sessions already. They're going really well. They're 2-hour sessions about every 3 weeks, taught by Virginia Tech faculty. And then in May, we're going to have a big review session, because for some of them, this is a review, but for others of them, this is really the first time they're exposed to a lot of this, like the theory behind the practice that they do. So the goal hopefully is for a lot of them to sit for the exam next spring or next summer, and we will see how that goes. And I'm doing an evaluation. So after every session, I'm doing an evaluation, and then I'm hoping to do kind of a big evaluation, follow through, see who, you know, of who sat, how many people passed it, which is hopefully going to be everyone. We'll see. All right, next slide, please. So these are my other duties. Each of the session is 2 hours. I just saw a question pop up. So we did 2 hours for leadership and communication. I combined those. Some of them we separated it out. So for example, the evidence-based has both epi and biostats, and that is a lot. So we separated those out into 2-2-hour sessions. Same with infectious disease and environmental health. We separated those out. And yeah, so far we've had 4, and it's so far going really well. So other duties as assigned, I do a lot for the health department, which I love. I love the practice piece of it. I have experience in strategic planning, and they needed a new strategic plan, so I helped with that process. I've helped with their marketing and wellness team. I've helped with event planning. I participate in a lot of different community teams. Basically for 2 years, 2020, 2021, I speak Spanish, so I was doing case investigations. I was helping at testing sites, vaccine clinics, and then other duties as arise. And that's one of the things I love about it, is that they know they can count on me to help whenever I can, if I have time, which I will make time for the health department. So I really do love that relationship where they know they can count on me, and I like being able to help them with whatever. Next slide, please. And then, yeah, we have staff that come and lecture in the classroom. So environmental health or epi outbreaks or working with the media. This is the kind of stuff that, faculty can teach, and maybe, teach the theoretical piece of it. Maybe they've had experience in the field, maybe they haven't, but, someone from environmental health will come in, or someone who does epi outbreak investigations will come in and just share stories. And, they may have learned in class that, well, an outbreak investigation is A, B, C, D, E. You go, that's the order you go in. But then the person from the health department will come in and be like, well, yeah, it's A and then C and then E and then B and then D, so really showing the students that, like, there's one thing that you do in class and then there's practice. So the students really enjoy when they have people from the health department coming in and sharing stories with them. Next slide. So some lessons learned to share with you all. The joint position, my position, is really key. You can do it without one, but it is really nice to have. If you can't have a position like mine, I would suggest having someone at each of the organizations that you designate kind of as that liaison, so at least they can talk to each other. It's important to be able to get that buy-in from both partners, including the higher ups. So that's why we went to the president, we went to the commissioner, because we really wanted to have their buy-in. Anytime you have students working on the ground, you want to make sure that you have a position description for them with a specific, like, who is their mentor on the ground. I will say I learned this semester too with our academic public health core that you really want, it looks like I hope everyone can still hear me. I'm going to stop my video.
I can hear you.
You can hear me?
Yeah.
Okay, I was frozen. So I'm just going to stop my video just for a second and keep talking. Yeah, I learned that if you don't give a specific due date for students, they won't get it done. Not all of them, but some of them won't. So just to make sure that, due dates are critical. Stay connected, communicate as often as you can between the two organizations, and then definitely leverage resources where you can. Like, it would be really hard to hire a full-time person, but just having that small percentage from the health department really allows for me to be able to have a foot in both doors. Next slide, please. So how do we measure success? This is not everything, but this is a lot of it. So the number of students that we place, yes, numbers are great, but also the quality. How was their experience? Workforce development sessions conducted, and then the quality of those. That's why we always do an evaluation. How many faculty members are involved? I was so happily surprised to see the number of faculty members that were like, yeah, I'll do that. That sounds like fun. And we've had 4 so far, and all of them have had a blast. It's one thing to teach students. We love our students dearly, but it's a completely other thing to go in and teach people that are practicing in the field that do this every day. Like, I taught the leadership one, I'm talking about leadership models, and they're all like, well, actually, in real life, it happens this way. And that's great. It makes for great conversation. So far, all the faculty that have done it have just absolutely loved it. So they're getting something out of it too, which I wasn't expecting that, but I'm really happy that they're really enjoying it too. We look at collaboration. We look at, are we conducting our needs assessment? What are people saying? Presentations about the academic health department, and then, of course, grants submitted, accepted, and joint publications. Next slide. So where are we going? We want to continue doing what we're doing because it's working really well. We have great partnership. We want to continue our mentoring, of course. Just, every so often we'll stop, and this is really a reckoning that we did recently this past fall. evaluating and refining our scope. So, you know, we found we wanted to do more with the workforce development, specifically with the health department, more opportunities for student engagement. And then potentially consider expanding to other health departments. We have such a great relationship now in my joint position with New River that, you know, obviously they are a priority, and, you know, we really have a strong relationship with them. But if maybe there's other colleagues that would be interested in reaching out, I'm always available to help, you know, to help make new relationships. Next slide, please. So for those of you that don't have an academic health department that want to get started, feel free to use our memorandum of agreement. Better yet, contact Mayela at the Public Health Foundation. She probably has a list of all of them that she can share with you. Reach out to potential partners, start talking to them, come up with ideas, like start small and then grow. But definitely reach out and make those connections, and definitely use the Public Health Foundation. They are such a just incredible resource. And like I said, their goal is just to get more of these great partnerships going. So they will help you get started. And then I think that's my last slide. Yep. So here's my contact information. I love talking about our academic health department. I really value the relationship that Virginia Tech and the health department have. I'm happy to talk about it. So feel free to reach out to me. Maybe not in the next few weeks because I'm taking a break. But after that, I would absolutely love to chat more with you and answer any questions you may have. So yeah, thank you so much.
Great. Thank you so much, Sophie, for this wonderful presentation. We have a good amount of time for some questions. So please go ahead and continue adding your thoughts into the chat box. Also, if you'd like to raise your hand and come off mute, that'd be fantastic also to get a little bit more discussion. So I'm just going to stop sharing so we can see each other, see who's in the room. Feel free to turn your cameras on if you're comfortable. But maybe let's get started. Sophie, if you can tell us, maybe there was a lot that you covered. What would you say is your greatest accomplishment now that you're about 10 years in?
I think the relationship is the you know, just strongest of anything. Just the relationship that I've built with the health department, the people there especially. So yeah, the relationship I think is key, and taking the time to really build that relationship and nurture that relationship.
Great, thank you.
I see a bunch of questions in the chat. I don't know how you want me to deal with them, or if you want me to try going through them.
Yeah, I was actually gonna read them out to you.
Oh, perfect.
So you don't have to go looking through the chat.
Yeah.
So this first question comes from Caitlin, and the question asks, how much in percentage of time are students coming in to do in-person activities as part of their projects compared to virtually?
It depends on the project at the health department. You know, like those that had to go in and take pictures obviously had to do it in person. I think we've probably all experienced this, those of us working with students, that more and more they want to work virtually. So if they can, they prefer working virtually at whatever time is convenient for them versus coming into the health department. So depending on the project, sometimes they really don't need to come in. So I'm not going to make them. And that's also something that I asked them specifically in that original forum is, are you willing to come in? And if they're not, if they want to work remotely, then that's fine. But I'd say most of it is virtual. For practicum, that's different, because for practicum, we really want them on the ground and, you know, really observing and taking things in. So they spend more time in person. But for the academic health department discrete projects, a lot of them are virtual.
Great. And I think you touched on this briefly during your presentation, but kind of a follow-up question is, are the internships paid via the academic health department?
So most of them are not paid. I know this is a conversation I've heard over and over throughout the country. So if most of it is not paid. Like I said, though, I'm really hoping that for the discrete project for the academic public health core, that we can pay them, because it's, you know, it's less, and it's not through, like, it's not official, you know, it's not like they're getting their practicum hours for it. It's just they're getting work experience. So I'm working really hard to try to get funding for them for that.
Great, thank you. I'm just gonna very quickly, there are a couple of questions about how you get access to the recording. I'm just gonna address that really quickly. Everyone that registered for today's webinar will be receiving the webinar recording as soon as we get that up on the website. And then it will be made available via the PHF website. We'll do some kind of email blast via our e-newsletter, as well as the Council on Linkages update. So that should be coming to your inbox soon.
And I saw someone had a question about the survey tools used to match students. I'm actually happy to share that with you all. If you just shoot me an email, I am happy to share it with you. I just shared it with someone last week. And I'm wondering if Chrissy Bellick is from the Massachusetts Department of Public Health. I see MDPH, and she has wonderfully provided information. So thank you. And thank you for your ideas.
Great. Related to these project ideas, this question asks how you collect the project ideas and vet them.
Yeah, so I work with the administrator at the New River Health District, and she has a list that she creates. So it's a SharePoint site that I have access to, and she has a list of projects. So she's got what the project is, a brief, you know, 50 or so words about the project, how long it's going to take, what program it's with, when the due date is. So I go over those and I look at them, and then I look at the student skills, and I kind of match to make sure that I'm going to assign a student that's got the skill set to work on that. So it's not really a vetting project. It's not really a vetting process. It's more, you know, I just make sure that to get a student that's going to do a good job on it.
Great. Do you see this collaboration being viable with a local university with only bachelor's and doctoral degrees in public health, but not an MPH program?
I mean, I don't see why not. I think Bill or Ron or Mayela, you all could answer in more detail about what you've seen, but offhand, I'd say yes, why not? You know, it's academia and it's practice, and it's students and it's practice. And so I don't see why not. You know, we have a bachelor's of public health program here. They're not as involved in our academic health department, but they've done work with the health department before and done a great job too.
Ron or Bill, anything you want to add to that, or?
No, I think that's pretty much correct. A little bit depends on what kind of doctoral degrees. If they're DrPHs, a little bit more practice oriented, then there's probably a stronger potential for connection. But even a PhD program, depending on the research involved, could very much be focused on local practice issues. So I think the answer is yes, include them all.
Great.
Mm-hmm.
So this next question asks if you have any advice on how to recruit or engage with mentors and preceptors to host students.
So if this is specifically for the health department, you know, it's a small-ish health department, but I think the key is getting students that are going to do a good job for them. And so they want more students, you know, so it's that matching process. It's that strengths-based matching. So, you know, I'm not going to put a student who has absolutely no data skills and not really interested in data working with the epi doing data analysis. So it's that matching and just ensuring that they get good products, and then so they want more students. It's also taking the time to just be on the ground and to explain, here's what our students do, here's what they can do, here's what they can't do, here's how much time it's going to take to mentor, here's what precepting means. Really setting up those expectations clearly so they know what to expect, and they're not like, they don't have any time for the student, for example. That's the last thing we want. We don't want to send a student and the preceptor's like, oh, I didn't know I was going to have to sit with them weekly. So really setting up expectations, I think, is probably the most important. And just, yeah, taking time to talk and form relationships and, you know, chat, get to know each other. It seems silly, but it really goes a long way to have those personal relationships. So when you write for that, like, hey, do you want to host the student? They're like, oh yeah, I know you, I trust you. Sure. You know.
Great. Do you have a multi-year strategic plan for your AHD? And if so, will you share that with us?
I love that question, and I'm embarrassed to say that I do not, but we totally need one. Like I do strategic planning. Why don't I have a strategic plan for the academic health department? You know, we have ideas and stuff, but we've never actually developed it into a strategic plan format. So no. And Mayela, if you know of any, I would love for you to share them with me too. And it sounds like people here would be interested in seeing them too.
Yeah, maybe we can put out a call in the learning community later today and see if anyone's willing to share strategic plans if they have any.
Yeah, that'd be great.
Great. This next question is about the Public Health 101 curriculum. It says, what was the experience developing the curriculum and the collaboration with Virginia Tech administration?
So this was actually pretty easy because the CPH exam has very specific domains. It has 10 different domains. And so we're actually using the CPH exam kind of as our framework to teach the lessons. So we're just making sure that everything that is covered in the CPH exam by domain is included in our Public Health 101 series. We add stuff, you know, stuff that we think is important, but we just make sure that everything, since ultimately it's Public Health 101 / CPH review, we just make sure that we cover everything that's in the CPH exam. And I have it here. This is the, you can't see it because I'm blurred, but this is the Certified in Public Health Exam Review Guide. I think APHA puts it out. This is the guide that we're using. There's several different guides out there, but it's provided a really nice framework. And like I said, I broke some apart or combined stuff depending on how heavy the content was.
Great, thank you, Sophie. And I see, Ron, you also put in the chat about the Introduction to Public Health Practice training plan. Do you want to add anything about that? I just want to make sure folks know about it.
Yeah, it was just an FYI, because people, I always hear people asking about Intro to Public Health 101 and just sharing.
Great, thank you both. We have about 8 minutes left and only one question. So if you have additional questions, please throw them in the chat, raise your hands. We can have some time for maybe some back and forth discussion if folks want to turn their mics on. But currently the last question, can you speak about your division of work or FTE breakdown between the university, the health department, and how you kind of came to that percentage?
Yeah, I mean, I think it's a pretty sweet spot, 15 to 20%, because most of that is focused on academic health department. I could certainly spend a lot more time at the health department and do a lot of other stuff for them, not necessarily academic health department related. 20% is what we started off with, just with different things that have happened, including salary increases. It went down to 15%. But I think that's still pretty good. So it's about, you know, almost a day a week that I do something on academic health departments. And I can tell you it's not all in one day. It's 15 minutes here, it's 2 hours there, it's 30 minutes here, it's answering a phone call here. But it averages out to 15 to 20%. And that works pretty well. That allows me to still have, you know, my teaching responsibilities and my research responsibilities at Virginia Tech, but then really have a chunk of time dedicated to academic health department. And that includes, you know, if I'm doing an evaluation for them or something, working with their community health workers. Just recently, I met with one of them to, you know, go over logic models and how to set up a logic model for a program. So all of that stuff that I do for them.
Great. Any other questions in the room?
Hi, Dr. Wenzel.
Hey.
Thank you for your presentation. I am the academic health department coordinator for the New Mexico academic health department.
Awesome.
And I was just To follow up on the previous question, do you know which grant funds your 15% health department time?
Yeah, so it's not grant funded. All of our health departments get what they call co-op funds that's funded by the localities. So that's where my funding comes from. So it's purposely not grant funded, so it's there every year.
Thank you.
Yeah.
Okay, if there are no more questions, I'm just gonna pull the slides
Oh,
back.
there's a question. How do you?
Oh,
get-
I
Okay,
just
great.
saw a question. Yeah.
Yep.
So I am the access to the academic library. It's pretty, as you can imagine, it's pretty hard to get access to the library if you're not like at least in an adjunct position. So the former health department director was adjunct. We haven't done that yet for this current health director, but basically what will happen is the environmental health manager will write me and say, hey, can you get me this article? And I'll get him the article. We haven't had to do it a lot, but that's how we've handled access is I have access to all Virginia Tech journals through their library.
Sophie, I have a question that comes up often and would love to hear your response because I think I might have heard it in the past. And that is the training of preceptors. And also, why should a health department employee who's busy with lots of different things be willing to be a preceptor?
Yeah. Yeah, I think that's what I was saying is like make it worth their while, you know. So we do training for practicums. We do all of the preceptors get the same training on expectations, etc. But I think the big thing is that they get something out of it. They're not just, you know, it's not just time sucking, it's also giving. And that goes back to that mutually beneficial relationship. And so we'll make sure that we have students that, you know, I don't want to say like the higher quality students, but students that are really invested in the health department. We're not just going to put someone there who's like, oh, whatever, I don't know what I want to do. We really want to keep this relationship strong. And so we have students that are dedicated to wanting to learn how the health department does, that go in with a specific skill set, or really wanting to learn a new specific skill set. And we make sure that the preceptors are ready, but also know what they're going to get out of it. So trying to set that up for success right from the beginning. And it doesn't always work. You know, sometimes there's students that just, for whatever reason, don't end up giving it their 100%. And that can burn bridges with preceptors. So we need to be really cautious about that.
Wonderful, thank you. So I'm just going to pull the slides back up here and do a couple of closing. Have a couple of closing slides here. Let's see. Okay. So there were a couple questions, I think, maybe in the chat about how to join the academic health department learning community. This is just a community that exists, as Bill mentioned at the very beginning, over 1,600 members, and it really is just a place for you to ask your questions, find folks that are either in their early journey of becoming an academic health department or more seasoned folks like Sophie that are willing to answer questions, share resources, things like that. So please, if you'd like to join that community, feel free to just send me an email. We can get you added to that. We also have these webinars a few times a year. So please stay connected to us, the Council on Linkages, to find out more about when those are coming. There is also, when you get a copy of these slides, you can kind of click on all these links. There is a webpage with all of the previously recorded academic health department webinars that you can go back and take a look at. We also develop resources to support the development, maintenance, and expansion of academic health departments. So please, again, stay connected to us about those things. And if you are not already a part of the Council on Linkages update, this is a newsletter that we send once a month that features the latest information about academic health department partnership resources, as well as other initiatives of the Council on Linkages. So thank you all very much. Again, please stay connected to us via phf.org/AHDLC. And if you have any other questions, you want information, you'd like to join the learning community, please feel free to just send me an email, and I will drop my email in the chat right now just to make it a little bit easier. But thank you so much, Sophie, again, for your time and your expertise and sharing all of the tools and resources that you shared with us today.
Yeah, of course. And people can definitely reach out to me too for any questions they have.
Great. Thank you so much and have a wonderful rest of your day, everyone.
You too. Thank you.
Thank you all. Goodbye now.